Scotland has long had a problem with drugs. In fact, it's a topic we covered previously. With the highest drug death rate in Europe, the question has less been why, more what on earth can be done. And a decision by Scotland's Lord Advocate, the nation's chief law officer, may have provided at least part of the answer. Soon, the Hunter Street Health Centre in Glasgow's East End will be home to a pilot scheme where addicts can take their drugs in a hygienic environment under the supervision of trained health professionals without fear of prosecution for possession. Supporters say it could significantly reduce the 1,051 lives lost to drugs in 2022. Yet it is but a pilot, and without investment into other areas, detox, treatment, rehabilitation, for example, Scotland could well remain addicted to being addicted. I'm Niall Paterson. Welcome to the Sky News Daily. Later, I'll be speaking to one charity boss who welcomes the news but thinks much more is needed. I've also been speaking to the father of one of those who lost their lives to drugs. But we start with our Scotland correspondent, Connor Gillies, joining us from outside the site where the pilot will take place. Connor, we have had the decision. The pilot will now proceed.
Yeah, this has been years in the making. We've had 5 Prime Ministers, we've had 2 First Ministers here in Scotland, we've had endless debate over this, and crucially, we've had more than 7,000 deaths since this idea was first touted back in 2016. So it's been a long road to here. Roughly 400 to 500 people inject drugs on the streets of Glasgow, which, let's remember, is Europe's drugs death capital. And the idea is that potentially that would drive those people inside these buildings where they will consume their own drugs. They will be surrounded by medical professionals, but they say, the medical professionals say, they will do it in a clean, safe environment, and that is the concept behind trying to drive down and reverse that really miserable trend of record numbers of people dying.
Just explain just a little bit more about what will actually take place inside these consumption rooms, how it will work.
So just to paint the picture of where we are, we're about half a mile away from the corner, which is the capital, the epicentre of Glasgow, Scotland's, Europe's drug problem, and that is where in the back alleys, on the streets, the car parks, the kind of typical areas that people think drug users inject heroin, inject cocaine, that sort of thing. So we're about half a mile, quarter of a mile away from that, in a tucked away area where this unit will be. And what will happen is addicts will come, they'll be armed with their illegal drugs, and they will enter through the building. They will enter into a reception area where they will check in. They will then be guided through by teams on standby into injecting bays. There will be 8 of those. I had a look in there yesterday. There are mirrors, there are medical bins at the side where people will put their discarded needles at the end of that. And then there is a waiting area, a rest and recuperation area afterwards, after they've injected that hit. But for years, the Home Office, which is in charge of drugs misuse policy across the UK, has not been in agreement with this concept going ahead, because they said, well, we're not making special exemptions for people to take drugs just because they are addicts. So that kind of led to stalemate for years. The Scottish Government has been in favour of this happening because they've been scrambling around trying to find any idea at all to try and reduce these deaths on their watch. And then it all changed about a month ago, a couple of weeks ago, when the Lord Advocate, who's the most senior prosecutor here in Scotland, issued a statement, a big statement after all these years of debate, where she suggested that it would not be in the public interest to prosecute people who enter these facilities that I'm in front of here just now, and that paves the way for what potentially could be a game changer in terms of Scotland's drug problem.
Is there an element, Connor, because obviously you and I have talked about this on the podcast before, Scotland has a massive issue when it comes to drugs and indeed fatalities arising from drugs. Are we kind of at the point of, trying anything to deal with the huge number of fatalities that we have per capita? I mean, it sounds on paper like a good idea. You've got medical professionals standing by if we've got the ability to test those drugs and make sure they are what the user believes them to be. But again, as you've been outlining, we are talking about people participating in an illegal activity in a facility that will be paid for with public money.
Yeah, taxpayer money, NHS staff, health professionals in here paid for by the public, and that's where it becomes controversial. I was also chatting yesterday to a drug addict who sleeps in the streets of Glasgow, has done most of his adult life, and he took a very different approach to the tales that we're hearing from the authorities who are in favour of this going ahead. He told me that actually coming to a facility like this will drive up crime. Crime will be a problem in these buildings when it is up and running, and also this will be a hotbed for the dealers, because the dealers will know, well, I'm going to get a good bit of business if I turn up at a safer drug consumption room, because the addicts will be bringing their own drugs inside and injecting them, unlike is the case at the moment.
I mean, Connor, for now, a pilot. Do we know how long this pilot will run for, and what the plans are if the pilot proves successful?
So there's a lot of money being injected into this from the Scottish Government's position, more than £2 million of public cash. Let's remember this comes at a time when budgets are being slashed elsewhere. The authorities haven't been clear on a timeline. I think it's probably fair to assume that if everything goes ahead as planned, it could be up and running in this building behind me here, potentially by next summer. The police have been clear, though, that while they're broadly supportive of this going ahead, they will still arrest people for crimes that they witness. So I don't think it will be smooth sailing. This is the first time it's happened in this country, and that will take a bit of finding their feet in terms of how this will actually work in practice.
Connor, many thanks. Let's turn our attention to those who have, well, very sadly, lost their lives to drugs. Andrew Cowan is part of the Anyone's Child campaign for legal regulation of what are currently illegal drugs. His son Daniel lost his life back in 2016. Andrew, a pleasure to have you on the Sky News Daily and on a topic that I know is very close to your heart. Can you just tell us a little bit about your son Daniel?
So Daniel was 29. He had got married in 2013. He was the middle son of three children. Very, very close to his family, a very kind of outgoing, gregarious character, funny character, loved stand-up comedy and so on, and was working in financial services, so had a good career. One of his hobbies was boxing. He loved to box, and for that, he had to make sure that he was at the right weight, so he was losing weight and eating healthy, and he was a really esteemed member of his local boxing club.
So where did things start to go wrong for him?
I don't know if they started to go wrong in the sense that we found out after he died that probably since school, since he was a teenager, he was the occasional user of recreational drugs like ecstasy, for example. But Daniel was a real party animal. He liked to be in parties and he liked to be socializing. That was actually my youngest son, who was very close to him, Sam, knew him very well, had never told us, but he knew that occasionally Daniel would sort of pop a pill or something at a party. Clearly, it's to my huge regret that I had never really sat him down and spoken about these things, but we really weren't aware. But he certainly wasn't an addict in that sense. He wasn't kind of on a downhill spiral, really. It was just one of these situations where he was partying with a friend and he took a substance which we now know to have been poisoned and to not be what he thought it was. Mm-hmm. The next morning, he couldn't be revived. He had died in the night after taking the tablets. And he left a massive hole in the family and is very, very much felt right into this day.
At the very least, what you have done is you have taken the absolute tragedy of losing your son and have decided to speak openly. Just in the few minutes before we started to talk, Glasgow City Council have given the go-ahead to safe consumption rooms, a place where people can take drugs under supervision. What is your view of that as a pilot and indeed as a broader policy?
I'm very supportive of that, and you'll understand that I was on a steep learning curve, as was family, because we really weren't initiated into the world of drugs or what the problems were for drugs in society, which is huge. And I'm embarrassed about that. But now being much more, unfortunately, informed and personally informed about that, my default would always be to find ways to help people who are part of this problem. And of course, when you see the deaths from drugs, particularly in Scotland, seeming to get worse every year, as a parent who's lost a child, you empathize with huge compassion for people who are bereaved and in their thousands every year. And so that makes me supportive of this kind of initiative, because what this initiative is trying to do is to help people at the sharp end. I'm not saying it's the whole answer, but as a starting point would be to help people who are intent on taking drugs to take them more safely in an environment where they're less likely to die as a result of taking the drugs. We're seeing it all over Europe. This is something that's been happening for decades in other places in Europe. And as far as I can see, the results seem to have been successful in many ways across Europe. And of course, there are the worries. Will this encourage drug taking? Will this incentivize drug taking? And I completely understand these different arguments. But I think we have a duty as a society to help people who are going to do things that we disapprove of. We do that for mountain climbers. We do it for people who get involved in all sorts of extreme sports. We people who drink too much and eat too much. And we can't just abrogate responsibility for helping these people to be safe, whilst at the same time trying to educate them as to how to live their lives in a better way.
I suppose another counter-argument that could be made relates to the word you just used there, safe, that the idea that these consumption rooms make taking narcotics, the harder drugs, safe, which is obviously untrue, that there is no safe way in which someone can take something like heroin, crack, cocaine, so on.
It's not just about the consumption of drugs and how we make that safer. It's also about the manufacture of drugs and how we make that safer. Daniel, he thought he was taking ecstasy, as far as we know. He was with a friend on the night. There was no other witnesses. We only have the police reports and so on. But we're pretty confident that he would have thought he was taking ecstasy. It transpired in the death certificate that it was MDMA, which is ecstasy, but also heroin. And actually, about a year after that, and I'm not quite sure how this arose, but the police contacted us and said they did suspect that it was fentanyl. And fentanyl, in case people don't know, is a synthetic opioid, which is the ingredients come from China, but it's manufactured in Mexico. And it's a huge problem in the US at the moment with literally tens of thousands of deaths. And there are ways that we can make that safer. It's clear that if you're with somebody else who has training on how to help you if you go into overdose, and there are substances that you can take. If, for example, if Daniel had taken naloxone once he was into his overdose, he probably would have survived.
I suppose, Andrew, that as Scotland deals with its drug issues and you continue your campaigning, always in the back of your mind must be that things could have been different for your boy, for your lad Daniel.
It's probably almost the only thing that's there, because I take my mind back. We believe from the police report that he was with his friend. In fact, I'd spoken to him in the afternoon. It was a Sunday, and we'd had a long chat because he was just renting a new flat and he was worried about the fact that his new job was only probationary and would that be a problem? And I was talking to him and giving him advice about that for about an hour. And after that, I think he went down to the high street and was just doing a few things with his friends and then came back. And it was that evening that he took the drug. And I sort of imagine in a different world, instead of getting drugs on the dark web, which were poisoned, maybe he would have gone down to his local pharmacy where there would have been recreational drugs on sale, which had been manufactured by reputable pharmacists, and there was safety things on the back and whatever, as there is with drink and cigarettes, whatever. But he would have taken them in a safer way and would still be alive today. That's a very different kind of society where the approach to drug taking would be very, very different from the one that we have now. And that haunts me, that might have been the case for Daniel.
Most people, most parents, thankfully, will not find themselves in the situation that you have. But I wanted to ask him, were you ever angry at him for what he had done?
Don't think I was ever angry. And not only that, I wasn't angry at the person that had his friend who had got the drugs. They were very close, and his friend was devastated when he found him dead. And in fact, he himself, that friend, died of a drug overdose about a year later. I think much better to not be angry, and certainly not be angry at Daniel. Everybody makes a mistake. He made a mistake. I would have preferred if he hadn't taken drugs ever. He did occasionally take drugs. Does that diminish my love and respect for him? No. I wish I had spoken to him about it and warned him about it, and I wish he had been more educated about it. And we could certainly do things about that. But I certainly don't have any anger for him at all.
My thanks to Andrew for speaking so candidly and indeed so movingly. Stay right where you are. In just a moment, the chief exec of one drug charity who welcomes the pilot but says much, much more needs to be done. Back in a sec. The decision taken by Glasgow City Council has been broadly welcomed. Indeed, some have been arguing for a radical rethink of Scotland's approach to drugs for many, many years. Annemarie Ward is Chief Executive of Faces and Voices of Recovery UK, an addiction charity. Welcome to the podcast, Annemarie.
Hi, Neil. Thanks for having me.
Well, let's go straight to Glasgow and the pilot scheme. We now learn that the decision has been taken that there will be a safer consumption room opened there. What's your view?
Well, yeah, I mean, we advocated for drug consumption rooms, over 10, 12 years ago. So we welcome this as one of the steps that Glasgow or Scotland should be taking. Glasgow only spends $500,000 a year on getting people off drugs and on actual rehabilitation. So we as an organisation, we advocate for choices and chances. And unfortunately, because Scotland is completely wedded to only a harm reduction philosophy and, quite frankly, a zealotry around harm reduction, we don't have any of the other 4 pillars in place that other countries where drug consumption rooms have been evidence-based and can claim, work. We don't have those other pillars in place, like prevention, like treatment, like integration. So it's a wee bit like putting the cat before the horse.
But in a sense, is it not understandable, given the level of fatalities that we see in Scotland relating to drugs, to immediately focus on bringing that number down?
What we're actually saying here is that the addiction sector has completely given up. In fact, it doesn't actually know how to get people well in the same way that it does in England. That's one of the reasons why we've got 3 times more deaths. We've got a completely different system. When you compare it to England, there's far more people in the workforce. In England, over 50% of the workforce in England will be people in recovery, whereas in Scotland, we have, maybe less than 5% of people in recovery. It doesn't know how to deliver recovery. It doesn't know how to help people get well. We don't even have a detox facility anymore in Glasgow,
No, seriously. Sorry, just Annemarie, just on that. You do not have a detox facility in the drug fatality capital of Europe. You don't have a detox facility.
No, absolutely not. We've only got 23 rehab beds, and the majority of them will be taken up by people with alcohol problems. Let me just spell this out for you. In Glasgow, we have almost 200,000 people registered in the Greater Glasgow and Clyde area as having problematic alcohol or drug use. Now, that stat comes from Glasgow's Health and Social Care Partnership, its own report. Now, if we're only spending $500,000 on rehab, and we are not giving people access to community detox, we stopped doing that in Glasgow about 10 years ago. Let me do a comparison for you. Our heroin-assisted treatment programme in Scotland in Glasgow costs £4 million a year to run. There have been 24 people took part in that, and they can take part in that indefinitely. They have had 26 overdoses from the 24 people during the 2 years that it's been running. There has been 2 deaths. Okay, now compare that to actual rehab, where people can get off drugs and start to become contributing productive members again. They're only getting $500,000 investment, so $4 million for heroin-assisted treatment, $500,000 on rehab, and you can only attend that rehab for 12 weeks, whereas you can attend the heroin-assisted treatment programme. In fact, we spent almost £100,000 and people get taxis to get to the heroin-assisted treatment programme.
I presume that there are problems elsewhere in Scotland as well, but who do you blame for the lack of provision of the services that we've been discussing?
You only have to follow the money to see, again, where the majority of the investment was going. It's going into very credible and useful harm reduction interventions, which I wouldn't take money away from, but we've stopped investing in recovery services, and the culture of our addiction services is not recovery orientated anymore. The drug problem has got, as has the alcohol problem, got, deepened and got a hell of a lot worse. So there just is not enough investment at all in this area. And there, as I said, it's absolutely mired and infested by ideology.
Well, Annemarie, wish you and the charity, Faces and Voices of Recovery UK, all the best with the work that you're doing. Thanks so much for joining us.
Well, thank you for the opportunity to speak, Neil. Thank you.
We asked Glasgow City Council for a response. They said this.
More than 600 people were admitted to a range of residential services in 2022, not just its 23 abstinence rehab beds. Alcohol and drug recovery services provide access to detox for inpatients and in the community, with community detox being an integral part of care and treatment.
And that is your lot for this edition of The Daily. We'll see you next time.